Well, right now, well wishes are pouring in tonight after former President Joe Biden announced he's been diagnosed with an aggressive form of prostate cancer.
According to the president's office, the cancer has spread to the bone. They also say the Bidens are reviewing potential treatment plans and say this form of cancer can be effectively managed.
So joining us right now is Dr. Clara Hwang, a medical oncologist from Henry Ford Health specializing in genital and urinary cancers. Thank you for joining us, doctor. So I've got to ask this question. I can only imagine that it's top of mind for a lot of people right now. Whether an aggressive cancer like this is common with someone who's been receiving top-notch medical care like the former president.
Well, thankfully, situations like this are relatively uncommon, but it is true that despite our best efforts, there will be still some patients who are diagnosed with metastatic disease.
Yeah. What are the options in terms of treatment? We heard that statement from the Biden family, saying that they're exploring what to do next. What are some of the options?
Well, his doctors will, of course, take his other medical conditions into account, his age, his current state of health. But fortunately, even advanced prostate cancers are very, very treatable. They respond very well to hormonal therapy. And so that will be likely a cornerstone of his treatment, hormone therapy.
And Dr. Hwang, what do you want men to know about treatment options and screening options right now?
So for treatment, I think, as you brought up, that this kind of cancer, although it is aggressive, it is very, very treatable. And I think for screening, I think the message that we should give people is that early detection for prostate cancer is still very, very important. If we can find the cancer before it has spread, we are able to cure cancers when they're limited to the prostate. So we do have ways to detect prostate cancers early, and I would encourage men to talk about that with their doctors.
Sure. So help me understand, when you say that someone has prostate cancer and it's metastasized to the bone, does that mean that you also have bone cancer and you have to be treated for two separate cancers? Help me understand that.
So actually, that's a great question. I get that from my patients quite a lot. But we treat it from the place where it started.
Okay.
So if it is in the bone, but it's still prostate cancer, it remembers that it's prostate cancer, and it still responds to the same kinds of treatments, which in his case would typically be hormonal therapies.
So no radiation or chemotherapy? And you're not his doctor. We should, of course, point that out. You're not on the team or anything like that.
We do sometimes use radiation and or chemotherapy and even newer hormonal therapies in men who have advanced prostate cancer, but it very much depends on the situation. So for example, there's something where we call doublet therapies, where we give what we call androgen deprivation therapy plus a novel hormonal pill, and that may end up being what he's treated with. I'm not sure. Sometimes we give people triplets. That's where we add chemotherapy. Sometimes we use radiation either to the prostate in certain situations, but also possibly to one of the bone metastases if it's causing some type of a symptom.
Sure.
And one final question before we wrap up, doctor. I know the age for colon cancer screenings has decreased. When should a man be asking his primary care physician about prostate cancer?
I think 40 is a good general rule of thumb. That's the current age that's recommended for starting to colon cancer screening currently. For prostate cancer, it does depend on risk, but for the highest risk patients, the recommendation is to start the screening discussion at age 40. For men at average age risk, it is age 50, but if you're going to be talking to your doctor about cancer screening, you may as well get a plan for yourself. Should I start the testing at 40? Should I start it at 45 or 50? But I think they can have the conversation at age 40.
And Dr. Hwang, thank you so much for having this conversation with us, especially since this is a hot topic on a lot of people's minds.
Absolutely.
My pleasure. Yeah. Thank you for inviting me.
Yeah, absolutely.